Okay, we will talk about the tongue innervation. So we have the motor innervation. This is for the muscles that control the tongue. And we have the sensation of the tongue, and that's to feel the cold and hot food. And sometimes in the question it says anesthesia. For example, a patient went to a surgery and now the patient is complaining of anesthesia. And the last thing is for the innervation is for the taste. As we know, the tongue has many boats that are used for taste, for example, sweet, sour, and salty. In this video, we're not talking about the motor innervation, but we're talking about the sensation and we're talking about the taste. Why? Because they are quite similar. All I need to learn is I will divide the tongue into three parts: anterior, 2/3, posterior, 1/3, and the last one is the extreme posterior of the tongue where the epiglottis is. Notice that for the sensation and the taste, it's the similar. For the posterior 1/3 of the tongue, that's this area, they both innervated for the sensation and for the taste by the glossopharyngeal nerve, which is the nerve number 9. And for the extreme posterior of the tongue, where it meets the epiglottis, it's innervated by the vagus nerve. But what's really different here is the anterior 2/3 of the tongue. For the taste is innervated by the facial nerve, the nucleus. It's called nucleus solitarius. But for the sensation, it comes from the trigeminal nerve, the mandibular branch of the trigeminal nerve, and the lingual branch of the mandibular branch. Means this is the trigeminal ganglion, and it sends three branches. The first one is called ophthalmic, the second one is called maxillary, and the third one is called the mandibular. And then the mandibular branch will send some branches off. One of these branches is called the lingual branch. The lingual branch will go to the tongue and innervates the tongue. It gives sensation to the tongue. Okay, read this question and tell me what the answer is. So the patient is having anesthesia on the anterolateral aspect of the tongue. That means anterior 2/3 of the tongue. Anesthesia, we said it's not the taste, it's about sensation. So which nerve is injured in this case? So the answer is the lingual nerve. Okay, since we talked about the lingual nerve, I would like to talk a little bit about the trigeminal nerve. So as I was saying, trigeminal nerve, it gives three main branches. This one is called ophthalmic, this one is called maxillary, and the last one is called mandibular. And the one I would like to talk about is the mandibular branch. Mandibular branch will divide into sub-branches. Regarding the division of the mandibular nerve, there are nerves that will go inside the mandible, and there are nerves that will go outside the mandible. The ones that will go outside the mandible, we will call them anterior division. And it consists of two nerves, the first one buccal, and the second one is auriculotemporal nerve. So as you can see here, this is trigeminal nerve. So the first branch will go outside, and this second branch that will go outside. One of them is called auriculotemporal. Auriculo because it will go to the external ear and supply the sensory innervation to the auricle and the temporal region. And the next one is called buccal. And the reason it's called buccal is because it supplies the buccal mucosa over here, which is the inner cheek, and the cheek itself. That's why it's called buccal nerve, which is a branch of the mandibular nerve. The posterior branches of the mandibular nerve, as we can see here, if I turn it like this nerve is called inferior alveolar nerve, and it goes through a foramen here. It's called the mandibular foramen, and it will run inside the mandible. As you can see, it will run inside the mandible. And there is another branch that will go to the tongue. It's called the lingual nerve. So as you can see here, the anterior division consists of buccal nerve and auriculotemporal nerve. The posterior branch will give branches. The first one is the one we said, lingual nerve, and it supplies the anterior 2/3 of the tongue, the sensation, not the taste, be careful. And the second branch of the mandibular nerve, it's inferior alveolar nerve, the one that will go inside the foramen mandible, and it will go inside the mandible itself. That's why we cannot see here, because it runs inside the mandible. And once it reaches here, it will give a branch that will come out of this foramen. This is called a mental nerve. The mental nerve, mental in Latin, it means chin. Mental in Latin means chin, and it will go and supply the chin region and the skin over the chin region. However, the inferior alveolar nerve, since it's running inside the mandible, it will supply all the teeth of the mandible. And the last one is called mylohyoid, and it will go and supply the mylohyoid muscle. This muscle is helping the tongue for swallowing. One last thing about the lingual nerve, as you can see here, it runs close to the mandible, especially very close to the third molar, which is the last tooth. That's why a lot of patients who are having surgery, for example, extraction of that third molar teeth, usually about 10% of the patients after the surgery, they will have anesthesia of the anterior 2/3 of the tongue. This is because the lingual nerve is closed, so sometimes it can get irritated by the procedure itself. Anything that has to do with the third molar. So it's going to be ipsilateral. So if the right third molar is being extracted, so the patient will have half of the anterior 2/3 of the tongue on the same side. So for example, if it's the right, then the right side of the tongue will have anesthesia, or sometimes numbness, or sometimes they call it neurobraxia. And maybe one last thing, mind you, the teeth itself, the innervation of the teeth itself is supplied by this nerve, which is called inferior alveolar nerve, which is also a branch of the mandibular nerve. And there is right and left, but it's not shown in the picture.